As the Republican Party begins its week-long pep rally for their dark brand of Trumpism, it should be noted that nearly 180,000 Americans have died from COVID-19 since March, more than 800 this past weekend alone. COVID-19 is now the third leading cause of death in America, behind only cancer and heart disease. A new CBS YouGov poll asked voters if they find this death toll acceptable. And while the vast majority of independents and Democrats do not, 57% of Republicans, nearly 6 in 10, believe that the staggering number of deaths of their fellow Americans is acceptable. That same poll asked voters to rate the job that Trump is doing handling the coronavirus outbreak, and 58% said that he's doing a somewhat bad to very bad job. With these troubling numbers weighing in on his re-elect, Trump seems to be grasping for a miracle cure. The Financial Times is reporting that the Trump administration is considering bypassing normal U.S. regulatory standards to fast-track an experimental coronavirus vaccine from the U.K. for use in America ahead of the presidential election. And yesterday, the FDA issued an emergency authorization for blood plasma as a coronavirus treatment, despite concerns from government scientists that there was scant evidence supporting the move. For more, I'm joined by Dr. Kavita Patel, former Obama White House Health Policy Director, and Dr. Bernard Ashby, cardiologist and Florida State lead for the Committee to Protect Medicare. Thank you all for being here. I want to go to, this is cut two for my producer, so I'm jumping around. Peter Marks, who is the director of the Food and Drug Administration's Center for Biologics Evaluation and Research, he has vowed to resign if the Trump administration approves a vaccine before it's shown to be safe and effective. He made this statement in response to concerns raised on a conference call late last week of government officials, pharmaceutical executives, and academics who serve on a vaccine working group organized by the National Institutes of Health. Dr. Patel, would you ever advise people take a vaccine that had not gone through a full and normal, rigorous clinical trial?
No, not at all. And I think, Joy, that's key. I think in order, we want Americans to have access to a safe and effective vaccine. And those are careful words that I'm using because that means a lot to scientists and regulators. And Dr. Marks has the utmost integrity. He represents what I think are legions of career scientists at the NIH and the FDA, and also places like the Mayo Clinic where they conducted this research. And I think it's critical to remember that we do need to see that data, number one. Two, we actually have external advisory committees that are in place to provide this outside perspective. We need them to review this. And then third, we need every American to understand that there are benefits to this and there are also risks. But I think that this politicization that we've seen, not just with this convalescent plasma approval, but started, Joy, with hydroxychloroquine, and it's continued on through. It's very troubling.
Yeah. And, you know, Dr. Ashby, you know, didn't to age myself, but I remember getting swine flu as a kid in the 1970s, and it was pretty horrific. And this strain of flu was discovered in the United States in 1976 during an election. And Gerald Ford, this is a famous story, Gerald Ford announced the administration plan to vaccinate the country against the swine flu. The vaccine was rapidly developed and delivered within just 6 months. Ford himself received the vaccine. The vaccine program was eventually suspended by the CDC after just 10 weeks when it was linked to a rare neurological disorder called Guillain-Barré syndrome. Waiting in long lines at schools and clinics, more than 40 million Americans, almost a quarter of the population, received the swine flu vaccine. Would you give a vaccine that had not gone through a full clinical trial, knowing the history of this, that there has been a vaccine in the past that actually hurt people because it didn't have enough time? Would you give a vaccine to your patients that hadn't gone through a full clinical trial?
So the answer is, well, thanks for having me, first of all, but
Sure.
The answer is no. I mean, that's an easy no. Science still is important. Science still matters. And therefore, we need to have appropriate clinical trials using all of the appropriate data and looking at these patients in detail before we distribute this vaccine to the entire population. And just to point out a few things, if the vaccine rates are any predictor, the population will not participate in getting this virus because they're concerned about, getting this vaccine because they're concerned about how much study is going into the vaccine. You have to get the trust of the public. And the previous polls indicate that a third of the population have indicated that they're not taking any part in this vaccine. And as a physician, credibility is very important. And therefore, the science matters, and we need to do the appropriate research and do our due diligence before we offer this up to the public.
Yeah, I mean, let me just play Gerald Ford. This was in March of 1976. Here is Ford announcing, and let's just remember that 1976 was an election year. Here he is.
Inoculations are to be available at schools, hospitals, physicians' offices, and public health facilities. The reaction to the shot, I am told, may mean a few sore arms for a day or two, a very small price to pay for this vital protection.
So this was a president acting, obviously, at least in part in his own interest, to try to get a vaccine out. Here's Donald Trump, and of course, and today it would be a tweet. There he is, complaining that the FDA was standing in the way of drug companies to test vaccines and therapeutics. Obviously, they're hoping to delay the answer till after November 3rd, yada, yada, yada. What is the danger, Dr. Patel, for the public when presidential politics and a reelect becomes of interest to a president rather than just the safety of the population?
It's incredibly dangerous. Joy, you have, unfortunately, we've undermined kind of the voice of science and public health. And with something as critical as a pandemic, with all these deaths, all these hospitalizations, and yet we do have progress on vaccines. So despite all this political rhetoric, there is valuable work being done. And the danger, as you stated, is really when this president and his administration kind of exhibit, I would just say, blatantly moral decay. And it puts doctors and patients and other health professionals in a very awkward position, because already, Joy, we're skeptical. And it doesn't have to be that way. We're already skeptical, even at the start of the, even at hello, we're already skeptical.
Yeah, I mean, people who are not anti-vaxxers at all are very nervous about anything that Donald Trump is rushing out before the election. I think I'd be very reluctant to take it. Very quickly before we go, Dr. Ashby, I'm sure your patients are asking you when there might be a vaccine. What would you realistically tell your patients or think, when do you think there will be a vaccine I can give my kids?
So a couple of these studies are in phase 3 right now. So we have to give those time to run their course. The answer is I don't know. It looks like sometime in January. However, I'm not rushing to give my patients vaccines. We need to focus on things that are high yield, that could decrease transmission rates and death rates right now.
Yeah.
So the fact that mask use was an actual debate is ridiculous. And the fact that testing takes so long is ridiculous. So we need rapid turnaround time, because that will have more of an impact right now than discussing vaccines right at this current juncture.
That's, I think, what infuriates people. A mask order and testing. Like, that's the simple, that is the Occam's razor answer.
Basic
Just
things.
do that, right? It's so simple, doctor. And I'm not even a doctor. This is so simple. Dr. Kavita Patel, Dr. Bernard Ashby, thank you all. We always appreciate you guys being on.